Thickening liquids is a necessity for patients with dysphagia. Thickened liquids prevent aspiration and/or penetration. Here are some tips on thickening liquids. Water and sugar-based beverages are the easiest to thicken. Using a spoon, measure the desired amount of thickener into a glass, pour beverage, and stir. A recipe is on the reverse side of every can of thickening agent. For nectar, you'll use 3 teaspoons, which equals 1 tablespoon of thickening agent. Pour 4 ounces and stir. Cornstarch-based thickening agent will continue to thicken after it is stirred for up to 5 minutes. So be cautious with the initial amount of thickening agent that you put into the glass. And that's a nice nectar consistency. Next, Gina will make a honey consistency. For 4 ounces of juice, Gina is placing 1 tablespoon and 1/2 teaspoon of thickening agent into the glass. So that's 3 white spoons and a half. I'm sorry, I got that wrong. That's 1 tablespoon and 1 1/2 teaspoon, which Gina, you'll notice, did properly. Should your beverage become too thick, of course, you can add an additional amount of liquid and that will thin it out. Too thin, just add a little more cornstarch and it'll thicken it up. Next, Gina will make a pudding thick consistency. And pudding thick consistency for 4 ounces of juice is 2 tablespoons or 6 teaspoons of cornstarch. You'll notice the ease with which Gina was able to thicken the sugar-based product. Water is also easy to thicken with cornstarch. Protein-based and hot beverages are difficult to blend with cornstarch. In order to make the nicest consistency, begin with a roux. A roux is made by, you're going to use nectar, so you're going to use 1 tablespoon or 3 teaspoons of cornstarch. Place it in a glass. Now take your protein-based or hot beverage, pour in a little bit, now stir. And you have a thickened base. Now add the liquid gradually and stir, and you'll get a nice smooth consistency. I have found that you can add the liquid slowly initially and then put the whole volume in, and you'll get a good smooth product. And you get a nice, smooth, essentially lump-free product for a protein or a hot beverage. Here are some tips to determine if your thickened liquid is pudding, honey, or nectar thickness. You will notice that Gina's holding now a nectar thickness. It may be a little bit thick because we let it sit for a while, so Gina's adding a little liquid. Nectar thickness will look like a melted milkshake, and Gina's going to make it that consistency now. In addition, a straw should stand in the glass and that will indicate that it's nectar. Honey thickness will look like pancake batter. Again, because we let it sit and because of the high sugar content, it thickened up readily. So Gina's going to smooth that down to pancake batter for honey thickness. That still might be a little bit on the thick side, so we'll just add a little bit more juice. As pancake batter does, it should fall in a wide stream from the spoon, but it should fall from the spoon. That's a nice honey thickness. In order to tell if it is honey, another test is to stand the spoon in the glass. And the spoon should stand up without falling over. Good. Pudding. You'll see now what many of our patients complain about. The pudding has set up too thick, and it's really like concrete. So again, Gina's going to thin that down to a nice pudding consistency. and we can see it fall in dollops from the spoon. And that's pudding. You've all heard the term mixed consistencies. Mixed consistency is any solid combined with a liquid where both remain in the liquid and solid state. For example, Gina's going to put cereal in the glass. And then add some milk. Even if you were to let the cereal soak to soften it, you still would not be able to blend the liquid and the solid together so it's one form. Gina will now lift the cereal, take a spoonful of cereal, and you can see that if you were to put that in the patient's mouth, the liquid would actually run over the base of the tongue, settle in the vallecula, or enter the airway, while the solid food remained in the mouth and the patient tried to manipulate it or chew it. The three most common mixed consistencies that we serve in the hospital are canned fruit in syrup. The syrup will penetrate the airway if they have a dysphagia. Cereal and milk. I might mention cold cereal and milk. And soups that have both a stock and vegetables. Again, you'll see our nectar, 4 ounces of juice, and that was 1 tablespoon of thickening agent. Honey, 4 ounces of juice, 1 tablespoon, 1.5 teaspoons thickening agent. And pudding, 4 ounces of juice and 2 tablespoons of thickening agent. For the protein-based drink, we have 4 ounces of milk and 1 tablespoon of thickener. The mixed consistency of cereal and milk should not be given to the patient because the milk will go down the patient's throat and penetrate or aspirate the patient while the solid food remains in the mouth and the patient tries to manage it. You can, however, thicken the milk to the patient's needed consistency, and that would be safe for the patient.